The views and opinions of the following show do not necessarily reflect the views and opinions of News Talk 1450 WOL, Radio 1 Incorporated, or their management.
This is Montgomery Mosaic on 1450 WOL, WPRS, HD2, and worldwide on WOLDCnews.com. Montgomery Mosaic features topics of interest to Montgomery County residents, businesses, and visitors. Here now is your host, Deborah Milo.
Good morning, Montgomery County, and thank you for joining us for another edition of Montgomery Mosaic. I'm your host, Deborah Milo. Well, it's already July, and summer is definitely here. I hope you're enjoying all the celebrations that come with the warmer months. You know, many of those celebrations are about being around family, and there's times in life when we find ourselves in circumstances where we have to take care of our family members. You know, family is very important in every community, and especially when it comes to dealing with life-altering issues such as health and illness. Well, my guests today are going to share with us some very vital information about hospice services, specifically Montgomery Hospice. I'd like to welcome the Reverend Dr. Sterling King, Chairman of the Montgomery Hospice Board of Directors, and Dr. Jeffrey Coleman, Medical Director of Montgomery Hospice. Gentlemen, thank you so much for taking time away from your very busy schedules to spend some time with us today.
Thank you for having us.
Thank you.
I'd like to begin by talking a little bit about your careers and how you both came to a career in compassion and caring, or rather pretty much a calling. Dr. Coleman, I'll start with you.
Well, I got into this profession when I was living in rural Virginia, and I was at a community health center there, which I managed, and there were many patients that were not able to come into the office. So I would visit them in their assisted living facility or at home, places like that. And there was one particular woman that came in one day that I had known for several years. She had been our patient, and she had lived in an assisted living facility. She came in, she had pretty serious pneumonia. And I told her, you know, you really need to go to the hospital. She's 90 years old. She has some respiratory distress. And she said, nope, I'm going back to my facility. I'm going to go back home to be with my friends because I know I'm dying. And I said, okay, all right. So I gave her some antibiotics. I gave her an injection. I said I'd go and see her in a couple of days, and I did. By that time, she was doing very poorly. She hadn't seen her daughter in a couple of years. Although she had made her wishes known to me, she hadn't made them known to her daughter. Her daughter came up from Alabama and saw her and sent her to the hospital, where they put in a tube in the side of her chest, and also they put her on a ventilator. And she stayed like that for 2 weeks. She was in a fair amount of pain. Finally, she got out of the intensive care unit, and they took her off the ventilator. They put her on a regular floor. And I used to go make rounds at the hospitals to visit my patients, just mostly courtesy rounds to say hello. And when she saw me, she said, Coleman, I'm going to kill you. You let them take me to the hospital. And I told you I wanted to stay at home. When I die, I'm going to haunt you the rest of my life.
You were in trouble.
And I think she did, but that's really what convinced me. Because afterwards, within a couple of weeks, she became ill again. She had made her wishes known to her daughter, and she did die at the assisted living facility.
Now, how old was she again, Dr.
She was 90 or 91.
90 or 91. Wow, she had quite a history then.
Oh yes, she was around Westmoreland County in Virginia, where I was for many a year, and so it was well known to the community.
Well, Reverend King, can you talk a little bit about how, I want to hear about your calling to this life of compassion and care.
Well, my academic background is in public health, in the area of health services administration. I spent over 3 decades at Howard University, and during many of those years I was involved in teaching students who were interested in managing in a healthcare environment, hospitals and various kinds of health care agencies. And through that experience, the classroom and working with students in internships and all, we got a chance to be exposed to a lot of the health services delivery aspects of it. I also, of course, I'm clergy, and as a pastor, I've had occasion to interact with members of our congregation in various settings in hospitals and in hospice environments and all. And so we've come over the years to understand really the importance of having the right patient in the right place at the right time, receiving the right kind of care. And hospice, in recent years, of course, has emerged as a very, very important entity in the personal health services delivery system.
Absolutely, absolutely. Well, gentlemen, I want to talk a little bit about the history of the hospice movement and talk about what is Montgomery Hospice.
Well, the hospice movement has been around actually for almost 1,000 years, actually. It originally started with the pilgrims that were traveling back from Palestine, from the Holy Land, in about between 1100 and 1200 AD.
Okay.
And on their way back, if they had illness, injuries, or whatever, they would stop at some facility, which was at that time called a hospice, for rest and treatment. Later on, the movement spread further in Europe, where the first official hospice opened in France in the mid-1800s. The modern hospice movement really began with Dame Cicely Saunders in England, who saw that people that were dying had a lot of suffering, pain, anxiety, nausea, vomiting, many symptoms that were really uncontrolled. And their death was very much miserable.
I'm quite sure.
And so she opened the first hospice there, St. Christopher's Hospice. And that movement eventually spread to the United States in the 70s until it became part of the official Medicare benefit package.
Oh, my. Okay. Okay. County friends, thank you for tuning into Montgomery Mosaic on Talk Radio 1450 WOL. I'm your host, Deborah Milo, and today's discussion is focusing on Montgomery Hospice and the amazing work they do. My guests are the Reverend Sterling King Jr., Chairman of the Board of Montgomery Hospice, and Dr. Jeffrey Coleman, who is the Medical Director at the hospice. So we're having a really great conversation, so folks, you got to lean in and listen because this is some good information. So tell me, what is Montgomery Hospice?
Montgomery Hospice is a nonprofit organization, and it provides services to residents of Montgomery County. We have, on the clinical professional side, 9 different categories of personnel. There are physicians, there are nurses, registered nurses, nurse practitioners, certified nurses assistants, we have social workers, spiritual counselors, and people who are also available to share with patients in some of the sort of ancillary services. Montgomery Hospice has been around since 1981, so we've been providing services in Montgomery County for the past 35 years. And we are, of course, the largest hospice in the county. We're the only hospice in the county that has an inpatient facility.
I was about to ask you that, actually, Dr. King. Yeah, so you're telling me who Montgomery Hospice actually is.
Yes, and we have a board of directors, of course, which is very diverse in terms of the background of the persons. We have an employee population of something over 250 persons, and we have a lot of volunteers, about 300 volunteers who themselves undergo training. They make an important contribution to the professional staff in the delivery of our services. For example, during the year 2015, these volunteers contributed over 19,000 hours of their time, made over 14,000 visits, and they drove in excess of 10,000 miles in the delivery of services to our patients.
And these are volunteers?
These are volunteers, yes.
My goodness.
So, in addition to, again, the professional staff, the volunteers perform an important adjunct service to the delivery of our services in the county.
Now, let me add that most people think of hospice as a place where you go at the end of life.
Right.
And it's more that we come to you. We provide services in the home, at your assisted living facility, long-term care facility or nursing home. We provide services to homeless people.
I didn't know that.
And it's wherever you are or wherever you need to be served. Now, we do have our Casey House, which is our inpatient facility.
Right.
Which is used for people that have symptoms that cannot be managed in the setting where they're used to being in. So when people have serious pain, nausea, vomiting, shortness of breath, anxiety, agitation, any of those things, or need some other complex issues taken care of, then Casey House is there for them.
Okay, so Casey House is the standalone facility?
Yes, that's correct.
Okay, so is hospice, and I know that I'm glad that you clarify that, because I think that our listeners, well, me especially, was unaware that hospice is actually not a place per se, that it is a process. Is that what I hear you saying?
Yeah, it's more of a process, or actually I say that it's a benefit. It's a benefit given to you by Medicare, but all insurance companies offer some sort of a hospice benefit, and even if you don't have insurance, hospice can be there for you for people that don't have any insurance or have any way to pay for it, because we believe in our mission, which is to gentle the journey when you have serious illness with skill and compassion.
I like that.
And as you get closer to the end of life, and we all are getting closer every second, somewhere along the way, we will try to be there for you.
So hospice is not only for people suffering from cancer, because I think that that's a common misconception as well.
No, it is not only for cancer. It's really for people that are at the end of life. It doesn't matter if they have heart disease, Alzheimer's disease, cancer, respiratory problems as such. So it is whatever really that's making you decline rapidly. Usually we suggest, we take patients that really have a prognosis, expected life expectancy of 6 months or less, but give or take.
So is Montgomery Hospice affiliated with a religious group of any kind?
No.
No?
No.
Okay, then. So some of the types of services you were talking about earlier, can you go into a little more in-depth detail about that? I think, Dr. Coleman, that was you.
Oh, okay. We provide, primarily, it's nursing services in the home to provide people with comfort and symptom management, whatever it may be, and with their medications that are related to their illness. We also provide spiritual counseling, because people often have a lot of distress at the end of life in various other ways, which causes suffering.
Absolutely.
And they need help with that. We also provide social work services for counseling and support to be able to organize their affairs at the home or placement or wherever they may need it. Plus we have home health aides, which come and visit. They don't stay with you 24 hours a day, but they can come and help clean, take care of your personal self, etc. So, and plus we have volunteers.
Nice. When we come back, we're going to talk more about this, Dr. Coleman and Dr. King. Folks, you're listening to Montgomery Mosaic on Talk Radio 1450 WOL. And when we come back, we're going to talk more about the important and compassionate work of Montgomery Hospice. So stay with us. Be right back.
1450 WOL.
Good morning, this WOL traffic weather report brought to you by TrueCar, 295 southbound, flowing from Burroughs Avenue to Pennsylvania Avenue. Westbound on Silver Hill Road, it was construction in the right lane between Suitland Parkway and St. Barnabas Road at Silver Park Drive. So your utility work there, the right lane is blocked, a brief delay. On the Southeast-Southwest Freeway, expect to find it pretty slow both ways between the 14th Street Bridge and the 3rd Street Tunnel, but nothing reported in the way. Beltway looking better right now as you travel the inner or outer loop. Heading through the Maryland side, no more delays from College Park to Silver Spring. Save time and money by downloading TrueCar's mobile app. Configure the new car you want and get guaranteed savings. TrueCar users save on average over $3,000 off MSRP. Download the TrueCar app today. Now your WOL weather forecast. Scattered thunderstorms this afternoon, a high near 89 degrees. Clear to partly cloudy overnight, down to 73. Tomorrow, a couple of afternoon clouds, otherwise sunny and hot, a high near 96 degrees. Steve Hirschhorn for News Talk 1450 WOL, where information is power.
County friends, welcome back to Montgomery Mosaic on 1450 WOL, and I hope you're enjoying today's show. My guests are the Reverend Dr. Sterling King Jr., who's chairman of the board of Montgomery Hospice, and Dr. Jeffrey Coleman, who's the medical director at Montgomery Hospice. We're having a fantastic conversation about the kind of work that Montgomery Hospice does, and, this is really important, so I hope that you're gather around friends and family, because we're talking about issues pertaining to what happens with people who have end-of-life issues. So earlier we were talking about the different types of services that were offered in hospice settings, and Dr. Coleman, I think I wanted to also ask you, when should a decision be made about entering a hospice program, and who should make it? Because I know that that's something that is very difficult for many to make. And Dr. King, I'd like for you to also chime in on that one.
Well, making the decision to enter a hospice program is sometimes difficult for people.
I'm sure it is.
Because it may be an admission that things are getting worse and they're not going to improve. And it's for people that have illnesses that are not improving and that need symptom management mostly, and that's what we're focusing on. But anyone can make the suggestion or referral to a hospice program. It can be your physician, nurse practitioner, physician assistant, those in the or nurse at whatever facility you have, or it can be the patient. We often get calls directly from patients that say that they want hospice services. We will come out and evaluate them and see if they're eligible and contact their healthcare provider to see if they're appropriate. But usually it's for people that have illnesses that are not improving, that have a lot of symptoms and have a prognosis of 6 months or less. And usually I tell people about the surprise test, really, which is in 6 months, if you got a call that said that this person had died, would you be surprised or not? If you'd be surprised, you're probably not eligible, but if you'd not be surprised, you're probably eligible for hospice services.
I see. Reverend King, is there anything you'd like to add to that?
Yeah, only to say that I think in the African American community, there's been sort of a tradition of caring for our own at our homes.
Glad you said that, yes.
But hospice care should be viewed not as an alternative necessarily to taking care of the loved ones at home, but as a supplement to that service. And given the professional team that we have available to provide those services in the home, the nurse or the nurse practitioner, the certified nurse's aide working, this really provides a very, very excellent supplement to the people who are caring for their loved ones in their homes. And so I also would like to add that in addition to the sort of the clinical aspect of service delivery, there also are these other services that are really very special. For example, Montgomery Hospice has what's referred to as a threshold choir for people who are nearing the end of life's journey. And these are singers who make themselves available to sing songs that are appropriate, that are culturally sensitive to the patient and the family. Because hospice care is it's about taking care of the patient, but also the family of the patient.
Well said, yes.
And so we have various therapies that are available to the patient in addition to the clinical medical aspects.
We see ourselves as an adjunct to the family. We don't want to be there to replace them. Sometimes they do need more help than others, and we can provide that. Sometimes it has to be in the home, sometimes in our inpatient facility, Casey House. But we want to be there for the patient and for the families to give them whatever support that they need. And not only, it's not about dying necessarily, but it's helping them trying to live better.
I'm glad you said that. Yeah, so oftentimes I think we are miseducated and misinformed as to what hospice services or hospice really means. And I think that we associate it, if you will, with the death and dying. We don't think about it as a tool to, come back to life, so to speak. And I think that sometimes, especially in our community, we have a tendency to not understand it. Dr. King, you were talking about how we in the African American community, we like you said, a tradition of we care for our own. Growing up, we cared for my grandmother, one of my grandmothers, and so I do understand how hospice may not still be viewed as something that is important and necessary in our communities. Do you think that as well?
I do. I think there's a little bit of a history and a legacy in that regard, but I think also that education is an important part of this equation.
Absolutely.
And to the extent that our community is informed of the fact that, again, this is not to be viewed as an alternative
right.
to taking care of our loved ones at home, but rather as a supplement to that process. I think that we are finding that increasingly people in our community are beginning to tilt more and more towards recognizing the very, very important contribution that hospice services make in our community.
Yeah, most people really want to die at home. 75% surveys say that's where they want to be, yet actually 75% end up dying in some institution, unfortunately.
75%, that's rather high.
So it's just the opposite, and they often are very uncomfortable, and we try to eliminate that.
So talk a little bit about what Montgomery Hospice does as far as outreach to the African American community.
Montgomery Hospice is involved in sharing information with the African American community, especially through the churches. We have a very, very robust effort at outreach to African American churches in Montgomery County. And in quite in recent weeks, actually, we have started to make a little bit of an outreach effort into Prince George's County, where there is the possibility that we might have some opportunities to provide some services in that area as well. But one of the main areas has been through the churches and some other social agencies and organizations in the African American community.
Very nice. County friends, this is the July edition of Montgomery Mosaic on Talk Radio 1450 WOL, and my guests today are Reverend Dr. Sterling King and Dr. Jeffrey Coleman. Reverend King is the chairman of the Montgomery Hospice Board of Directors, and Dr. Coleman is the medical director of Montgomery Hospice. And we're talking about how the attitudes about hospice care differ within the African American community. So tell me something, Dr. Coleman. What do more African Americans need to broach, or why do more African Americans need to broach end-of-life planning? And talk about things one should know about end-of-life conversations with their family.
Well, many African Americans do not like to talk about death and dying or the end of life. It's very scary. Many physicians don't like to talk about it either. So
I don't want to talk about it.
Yeah, well, you don't want to.
Right.
But it is a reality. And so the important issues really is just to bring it up, and probably to bring it up in a non-stressful situation. It's always harder to make a decision when there's a crisis.
True.
We often talk about hope, and we do have hope for you. We want to hope that you will live a long and prosperous life and comfortably as possible, but times do come to an end. But so families just need to be able to bring it up. An important time that might be doing is at family gatherings, at least share the information that what do you want? Do you want to go to the hospital at the end of life, or if you have some serious illness, or if you have cancer or COPD, whatever it is,
right.
What is it that you would want? How would you want people to take care of you? If you just let them know that is a great start.
Dr. King, is there anything you'd like to add to that?
I would just totally agree with what Dr. Coleman just said, and to the extent that people are able, again, to verbalize or articulate their wishes and their preferences, both towards the end of life and at the end itself, how they would like to be remembered, how they would like to have their life celebrated. I think, to the extent that they can make those known, make those wishes and preferences known, and their families can be involved in that sharing, I think it smooths the process of celebrating their lives.
And I think it's important that we acknowledge and recognize, rather, that it is a celebration.
Yes.
I think that's a major part of it. I'm sorry, Dr. Coleman.
Yeah, it also takes the burden off of family members who maybe get stuck in some sort of a decision about what to do when they don't know, and then it's very conflicted. Should we go be very aggressive with this care, or should we focus more on comfort. What is right? What would mom, dad, your uncle, sister want in this critical time?
And finally, I would say that it allows members of the family, in addition to the patient, to celebrate the gift. Life is, in fact, a gift.
Absolutely.
And we're reminded that our children come through us, but not from us. From the Judeo-Christian perspective, we say that they come from God, and it is God who gives, and it is God who takes away. And
yes,
we say, blessed be the name of the Lord.
Absolutely. Amen to that. I want to ask you, before we go, do you have any pearls of wisdom you want to share?
Just to talk about these things, to have that discussion at some point. What is it that you want to do? Have it with your healthcare provider. Have it with your family. Just tell them, I don't ever want to be on a ventilator. I don't want to do this or that. So at least that they know. It takes the burden off of them, and also may save you some discomfort also. If just talking, really, and just to get it out in the open, especially maybe at a holiday or something like that when the whole family gathers.
I have to agree with you. Well, gentlemen, I'd like to thank you for coming on today's show to talk about the important and compassionate work you do at Montgomery Hospice. Well, County friends, that's all we have time for today. I hope you enjoyed and were informed by today's show. Tune in again next month for another Montgomery Mosaic on 1450 WOL, on WPRS HD2, and worldwide on WOLDCnews.com. Till next time, County friends, make it a beautiful day for yourself and for someone else. Bye for now.
To Montgomery Mosaic, featuring topics of interest to Montgomery County residents, businesses, and visitors. For more information or a copy of the show, email public information at montgomerymd.gov or call 240-777-6507. Be sure to tune in at this time on the second Wednesday every month for Montgomery Mosaic on 1450 WOL, WPRS, HD2, and worldwide on WOL.